Hello, this is Dr. Kodev, and this is Human Anatomy, Martini, Chapter 24, the Respiratory System. So on this picture here, we're going to get a nice overview of the structures of the respiratory system. And one of the things to note here is the upper versus the lower respiratory system. So look at this highlighted, I'm going a little high there, this highlighted line right here. So that highlighted line, upper respiratory system here, lower respiratory system here. Okay, so this line delineates that. So we're going to look here at the nose and the mouth. So air coming in at the nose, we see the nasal concha, and we're going to see these three areas here, inferior, middle, and superior nasal concha. It's going to warm, slow down, and humidify, and kind of clean up the air before it gets to our lower respiratory tract. So think about when you're breathing and you're calmly breathing through your nose. And then if you're exercising, you're breathing through your mouth. So the nose is slower, humidifying, cleaning, and going to warm that air up before it gets down here. Okay? But if we breathe through our mouth too much, it just dries out our throat, right? So up here is going to humidify the air for us. So we see the nasal cavity, the sphenoid sinus up here, internal nares over here, nasopharynx is where the nose meets the throat. And the tongue is always bigger than I ever expected it to be when you look at it in this viewpoint here. You can see the hyoid bone here. The larynx is the voice box, and then the trachea. If this were a tree, the trachea would be the trunk of the tree if this were an upside down tree. The bronchus, this primary bronchus, then we're going to see secondary bronchi later labeled. The bronchus here would be the branch, and the little tiny bronchioles. The upper respiratory tract consists of our nose, nasal cavity, sinuses, and pharynx. Pharynx, again, is just throat. Lower respiratory is our larynx, or our voice box, trachea, bronchi, bronchioles, which are just teeny tiny bronchi, and alveoli. Alveoli, or alveolar sacs, same thing. This is where the air exchange happens, is at the alveoli. A for alveoli, A for air exchange. You can see the nasal concha here again, superior, middle, and inferior nasal cavity, internal nares, that nasopharynx, and then the external nares, or your nostril area. So air enters the external nares, or our nostrils. It passes through the nasal vestibule. Think of if you walk into an office building, that first area is a vestibule, right? That first area in. So it's surrounded by two pairs of alar cartilage, enters the nasal cavity. Air flows in and around those nasal concha, warming, cleaning, moisturizing. We can see the little cilia here, right? The little hair-like projections right here. So the ciliated columnar cells here, these are pseudostratified, if you remember that term, because they're all touching the basement membrane, but it looks like they're stratified because the nuclei are one on top of the other. And then we see the goblet cells here. So if the cilia are little sweepers, little brooms to sweep the respiratory tract, the goblet cells have mucus in them. Okay, so it's a little goblet of mucus and it gets expelled. And I think of that kind of like mopping the floor, right? So our cilia are like the brooms that sweep. And then for a deeper clean, those goblet cells get involved and secrete mucus. You can see the basal cell there, right in there. You can see the brush cells and the small granule cells. The pharynx, or our throat, is the passageway. So it's an organ shared by the digestive and respiratory tract that connects the nose to the mouth to the throat. Our nasopharynx, or nose area, where the back of the throat meets the nose. Okay, where the back of the throat meets the mouth. Okay, and then the pharynx and the laryngeal area. So we see nasopharynx, back of the nose area, oropharynx, back of the mouth area, laryngopharynx, the area that has the entrance to the trachea, and esophagus. So you can see it here. Nasopharynx, where the nose meets the throat, oropharynx, where the mouth meets the throat, and then the laryngopharynx larynx territory. So our larynx, our epiglottis and our larynx. So epiglottis is the gatekeeper that closes over the glottis during swallowing of food, and that's going to prevent your food and drink from entering the trachea. The larynx is going to conduct air and produces sound and do a little bit of prevention of that food and drink from entering the trachea. So cartilage of the larynx, the thyroid cartilage, it contains that laryngeal prominence. And then we see cricoid cartilage, and we see that epiglottis, again, the gatekeeper of if this is going to the stomach or the lungs, and our paired laryngeal cartilage. So again, here we see up top, epiglottis, the gatekeeper. And then we see hyoid bone. Then we see thyroid cartilage. Right. Over here on the left, we're going to call this the larynx, or the voice box. And then we see cricoid cartilage, and then the cartilaginous rings of the trachea. You can see the little cricothyroid ligament. Ligament, again, connects bone to bone, or cartilage here, right? And then cricotracheal ligament. So again, normally bone to bone, or cartilage to cartilage, or cartilage to bone. And then from the posterior, we can see the epiglottis, that gatekeeper here. We can see the thyroid cartilage here, cricoid cartilage here, and then the thyroid cartilaginous rings that are C-shaped and don't go all the way around. You can see arytenoid cartilage here and the vocal ligaments here. Oops, like that. And then vestibular ligament as well. Thyroid cartilage, cricoid, and esophagus. So thyroid cartilage right here, cricoid cartilage right here, esophagus, the food tube right there, epiglottis doing its job of gatekeeping for the trachea or the esophagus. Here we can see the vocal cords, pretty interesting. So we see some cartilage up here. We're going to call it the corniculate cartilage, cuneiform cartilage. Okay. And then the vestibular folds right here. Okay. Here is the vocal cords. Okay, so vocal cords right here. Okay, vocal cords right here. So this is open, this is closed. You can see the epiglottis right here and the root of the tongue. So sound production by the vocal cords. Air passing between the vocal cords creates sound. Pitch depends on the diameter, length, and tension in the vocal cords. Children have a slender, short vocal cord or vocal folds, thus creating a high-pitched sound. At puberty, the vocal cords of males become thicker and longer, thus producing a deeper voice than females, typically. Amplification of sound occurs in the sinus cavities, and production of definitive sounds depends on the movement of our lips, our tongue, and our cheeks. This is a great slide for you to pause and check in on your anatomy here. So pause, take a look at the anatomy, quiz yourself, make sure you know what the different areas are, and then come on back. So the characteristics of our trachea, it's about 2.5 centimeters in diameter, contains tracheal cartilage, and again, it's a C shape, not a full ring, as we saw earlier. We can see the hyoid bone up top here. You can see the larynx, voice box. You can see the cartilaginous rings of the trachea. And if we look here, this is the trachea, the trunk of the tree, if it was an upside down tree. And then you see the first primary bronchi. And so right primary and left primary bronchi. And then you're going to see secondary bronchi here and here. Okay. And then here, you'll see the little lobes, okay, lobar bronchi, okay, superior lobar bronchi, inferior lobar bronchi, middle lobar bronchi. Okay, so middle lobar bronchi is right. Left does not have one because there's only 2 lobes on the left. There are 3 lobes on the right. The left and right primary bronchi branch off the trachea at the area of the carina. The primary bronchi enter into each lung. Primary bronchus is steeper and larger in diameter than the left. Hence, children can aspirate foreign objects into the right lung easier than the left. We also get more infections into the right lung a lot quicker. So it's the first spot and the last. It's the first spot for it to show up and the last spot for it to leave is that right lung. Structure of the pulmonary bronchi. Each primary bronchus divides to form our secondary bronchi and tertiary. Secondary and tertiary. Each tertiary bronchus goes to a specific lung area called the bronchopulmonary segment. So there's two lobes to the right, or two lobes to the left to make room for the heart, and three lobes to the right. The tertiary bronchi give rise to the little tiny bronchioles. They're self-supporting and don't require cartilaginous plates. Bronchioles terminate with clusters of alveolar sacs or alveoli, and there's 150 million in each lung, and that is the place where the air exchange happens. This is what it's all about. This is where the air exchange happens in the lung. It's the alveolar or alveoli air exchange. So our primary bronchus, cartilaginous rings, secondary bronchus, cartilaginous rings, you see cartilaginous plate, visceral pleura, you see a little bronchiole right there. You can see the little alveoli, little grape-like clusters right there where the air exchange happens. So again, upper respiratory system, lower respiratory system, make sure you know what is in what. And we can see our little alveoli is here. So lots of blood vessels, right? Because that's where the air exchange happens. That's where our deoxygenated blood is going to come and get oxygenated. So our body can get oxygenated blood. So you can see the little arterioles coming up into here, which is very rare that it's blue, right? That it's deoxygenated because it's the pulmonary circuit. So our artery and our arteriole is carrying deoxygenated blood artery away from the heart, come into the lung, pick up oxygen. And then it's going to have oxygenated blood in the vein. Okay. So when we inhale, a little reminder here on mechanics, air is inhaled because of negative pressure breathing. We're going to see the diaphragm contracts to move down. Okay. And that's how air rushes in. Okay. Air is exhaled when the diaphragm relaxes and it moves up. Okay. And then those little alveolar ducts or the alveoli, we see each lung again about 150 million, and we see this extensive network of capillaries because that's what it's all about. It's getting the deoxygenated blood there, air exchange happening here, releasing carbon dioxide and other things, and then we are getting oxygen and whatever else that is bringing into our lungs, okay, oxygenating our blood. So the capillaries drop off the carbon dioxide, pick up the oxygen. The elastic tissue surrounds each alveolus and maintains its shape and position during that inhalation and exhalation that we just saw. So our alveolar details here, the cells associated with alveoli. The lining consists of a single layer of squamous cells, type 1 pneumocytes, pneumo meaning air, cyte meaning cell, air cells. Type 2 pneumocytes are scattered among the type 1s, secreting surfactant that prevents alveolar collapse. We see alveolar macrophages or dust cells wander around eating particulate matter. Amazing, right? So type 1 pneumocytes and type 2 pneumocytes. So type 1 comprise only 40% of the entire alveolar lining cells. They're extremely thin squamous cells. They line 95% of the surface. The occluding junctions among them form an effective barrier between the airspace and the septal wall, or the wall that's separating. Our type 1 cells are not capable of cell division. Now our type 2 pneumocytes are large, same size as our macrophages, big eaters, and contain pale inclusions or surfactants, and they're the progenitors for the type 1. Another nice picture here. In this view, you can pick out the red blood cells in the capillaries of the connective tissue between the two alveoli. Pretty neat to be able to see the area here where that gas exchange is happening. You can see a view of the lungs here. So you could see again the 3 lobes, okay? Superior lobe, middle lobe, and inferior lobe of the right lung. Left lung has a superior and an inferior, and then a cardiac notch there for the heart. Okay. You can see the cut edge of the diaphragm. We went through that. That's that dome-shaped muscle of breathing. We see the falciform ligament right there. You can see the inferior lobe of the left lung. You can see the superior lobe of the left lung, superior, middle, and inferior of the right lung over here. And then you can see its boundaries, the horizontal fissure, oblique fissure separating the two. You can see oblique fissure separating the 2 lobes over here. You can see the fibrous layer of the pericardium, or that sac that surrounds the heart. And you can see the boundary here between the right and left pleural cavities, separating those out. And all the way down here, you can see the liver, okay? The right lobe of the liver and the left lobe of the liver. Structure of the lungs, the apex points superiorly and the base is inferior. Okay, so sometimes we see it the opposite, but this one, its apex is up top. Okay. Right lung has 3 lobes. Oops, let me move some stuff around here. I'm a little stuck. My screen is stuck. All right, right lung has 3 lobes. Superior, middle, and inferior, as we saw, it consists of the horizontal fissure and an oblique fissure in between them. So fissure is just a deep crack separating those. The left lung has 2 lobes, superior and inferior lobe, with the oblique fissure separating the 2. The left lung has a cardiac notch and cardiac impression. Right lung doesn't have that. Okay, so left lung is getting the cardiac notch and cardiac impression because of the heart. So respiratory muscles and pulmonary ventilation. Pulmonary ventilation is the physical movement of air into and out of the lungs. So when we see this word part, PNEA, that's air. Okay, this part is air. Okay. And so we see these respiratory movements. Respiratory movements can be classified 2 ways: eupnea and hyperpnea. Eupnea and hyperpnea. So this is quiet breathing or true. Okay, when you see EU, that means true. Okay. And so this is just normal quiet breathing. May involve diaphragmatic breathing, costal breathing, or both. During pregnancy, due to the uterus pushing upward on the diaphragm, women will typically use the costal breathing. Hyperpnea, forced breathing. So this is when you're breathing heavy. Okay, so you're exercising or it's difficult or labored breathing. Let's talk a little bit about COPD, or chronic obstructive pulmonary disease or dysfunction. And we're going to look at this as emphysema. Put this down here. We're going to see it as emphysema, chronic bronchitis, and asthma. Emphysema, chronic bronchitis, and asthma is going to be part of our trilogy of COPD. So traditionally referred to as emphysema, chronic bronchitis, since many patients overlapped damage at both at acinar level emphysema and bronchial level bronchitis. Emphysema is when you lose the elasticity. Emphysema, elasticity. You lose the elasticity, just like for like old elastic in some pants. So like if the pants lose the elasticity, they're not tight anymore. They're loose, right? And they don't snap back. Okay, so they're overinflated. Okay. And then number 2, that small airway disease, a variant of chronic bronchiolitis, is now known to contribute to obstruction, both emphysema and chronic bronchitis. And while asthma is distinguished from emphysema and bronchitis, by the presence of reversible bronchospasm, some patients will develop an irreversible component to it as well. So in most patients, COPD is a result of heavy smoking, right? About 90%. It's the third leading cause of morbidity and mortality, depending on the year. I put this diagram in here for you to kind of overview. You see oxygen-rich air coming from the environment. Then we see the nasal cavities or the mouth, then the throat or the pharynx, trachea, bronchi, bronchioles, alveoli where air exchange happens, oxygen, carbon dioxide exchange at the alveoli. Then it goes back through the bronchioles, bronchi, then through the trachea again, pharynx, nasal cavities, and out. There you go. I'll see you for the next chapter.